Hi there, my name's Ed Parry-Jones. I'm a GP, works in Plymouth. I'm working in a big salaried practice called the Mayflower Medical Group. Also work for our CCG. I'm currently involved also in setting up the COVID Hot Hub or COVID Primary Care Assessment Centre, which I'm currently in now. That's why the whole coronavirus thing sort of kicked off. I was actually on holiday in Morocco when we suddenly had to be evacuated, which was quite stressful, and then came back and had a couple of days of holiday after that, but was desperate to try and help in some way. Suddenly the world had turned upside down in terms of our general practice work. I'm also clinical lead for our practice as well, so there's a lot of couple of days spent just reading emails and trying to reorientate myself what was actually happening. Those things kept changing every day. My wife's a community physio, and she was worried about what she was going to have to do. She normally goes to visit elderly people at home and also nursing homes, and her job changed quite a bit. She had to see people remotely by video link. Also, when I did start, after a couple of days coming back from Morocco, we had to do everything different in the surgery. We suddenly had to change who we're bringing into the surgery. A lot of time going through these shielding lists, which caused a huge confusion amongst the practice and patients as well. But we managed to sort of get through that. People adapted amazingly quickly in the practice. All the staff, receptionists, telephonists, the nurses, the doctors, paramedics that work with us, all adapted incredibly quickly and just got on with things. It was amazing to see. We had to completely change their clinic templates from just going in and seeing patients one after the other. We turned completely to doing everything through e-consults or telephone triage. We'd actually just started to do e-consults about 6 months before, and actually a month before COVID kicked off, we had actually changed to doing everything through e-consults anyway. It was a completely total triage system, so that actually worked in our favour, and that we were all quite used to doing those. Difficult to work out which patients to bring into surgery and which patients not to bring in. Also, there was a lot of discussion about which services we should stop and which not to stop. The guidelines were coming out in dribs and drabs, and we really had to make some decisions very quickly. On my CCG days, which were 2 days a week, again, everything changed there. I normally would go into the office and meet people, but now we suddenly had to do everything with arranged meetings, which worked well, but you had to arrange a meeting instead of just going to talk to people. You might just go to someone's desk or talk to people in the coffee room about certain problems, so that meant that was more tricky to do that. So I wanted to do something to help the situation, so I got involved very quickly with a group of GPs in Plymouth who are setting up the COVID Hot Hub. What that does is it's a way of assessing patients with potential COVID who've got some symptoms but may be deteriorating. And the idea is to try and get those people assessed away from their normal GP practices, so that the GP practice can get on with seeing patients who are less high risk in a safe way, and also protects the staff and also the patients. We initially set up one practice to become the hub, but we had to then move to a different practice. And we've set up half of the practice here to be able to do that. The main way of assessing patients is the GPs will refer someone in with a symptom of maybe a cough or a fever. If they're then thought to be deteriorating in any way, if their breathing is a bit worse, but they're not at the stage where they definitely need hospital admission, in which case they call an ambulance, they could come up. If they've got their own transport, one of the family members, or they themselves can drive up and get an oxygen saturation done. We have an outside tent that they can drive up to and get their O2 sacs checked in that way. We also have a vital signs team that goes out and checks people's O2 sats on doorsteps. In fact, my two sons are involved in that. They're students. They go out in their own van and wear PPE and go and check the sats if needed. We're yet to set up a visiting service, but that's the next thing. Luckily, down in the southwest here of England, the cases have not been so high as other parts of the country. We've been very lucky, but there is a concern that when lockdown settles down, that we may get much more cases as people travel down here to get a break after lockdown, as they may not be able to travel abroad. They may come down to this part of the country. It's a very beautiful place, lots of beaches and lovely moors to go and walk in. So there is a concern that people will come down from the big cities and the virus may hit a second peak here. So I think the plan is to keep this coronavirus assessment hub going. But it's been a difficult time. We're looking forward to seeing my mum again and my sister when things settle down. It's my birthday tomorrow, so it's a shame I might not be able to see her on that day. But anyway, it's a relatively short period of time in the scheme of things, so we're all well.